Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Hello, and welcome to Getting Clear on Psoriasis. This season, we bring you stories about people living with a form of psoriasis called Generalized Pustular Psoriasis, also known as GPP. We aim to help people with GPP improve their overall quality of life and well-being through discussions on mental health, advice and tips for managing personal and professional relationships, and guidance on self-care. This podcast is for general information purposes only and should not be substituted for medical advice. Please consult a medical professional with any questions regarding a medical condition, advice, diagnosis, or treatment. In this episode, I'm joined by Nerea Moran, who lives with GPP, and Dr. Peter van der Kerkhof from Radboud University Medical Center in the Netherlands. We'll be discussing how people with GPP can manage mental and physical challenges to improve their well-being. Nerea, tell us a bit about yourself, and then Peter.
So I am from Spain, I'm from Leon, and I have lived in Ireland for the last 8 years. I'm a nurse and I have GPP since the age of 5.
And Peter?
I'm Peter van der Kerkhof. I'm a professor of dermatology at the Radboud University Medical Center.
And I'm Jilly Carter, and I'm your host for today's podcast. Nerea, tell us a little bit about the impact that GPP has had in your life.
So GPP is, as its name says, generalized. It can cover my whole body for long periods of time. So it can indeed affect almost every aspect of my life. For example, in my career, I have studied nursing in a time where my skin was quiet, and like any other nursing student, I will finish my degree and I'll start working, and I found myself in very dynamic jobs like in anesthesia, in theater, and also in the ICU while the pandemic was happening. And I didn't have any problems at the time, but then when I had a flare in the middle of the pandemic and I had to be off-site, I couldn't work for a long time, I had a kind of a reflection within myself that I have a debate. I didn't want GPP to rule completely my life, but at the same time, I acknowledged that I needed to find a way to still be able to work and to still be able to carry on my life, even though I had a flare. So that impacted the decisions that I made on my career, and I had to move away from jobs like the ICU or theater because it was so physical, working with my hands or to have it like weight on my body. I couldn't handle those kind of like physical aspects of the job while on a flare. So it has impacted the way that I decided to go back to study and to be able to navigate other options, so I could still be working even though I had a flare.
So you really have ensured that throughout your life, and you've had GPP since the age of 5, that this disease is not defining you. It's restricting you in some ways, but you're finding ways round them. And it seems to me that you're working very hard to get the balance right between your physical symptoms and your mental state.
Yeah, that's right. Even though I have long periods of times that the disease is not active, I will still be mindful in the background that I have this, and that I choose in my career or my life different aspects that will help me in the event that I have a flare. For example, no working in the ICU, because I know that if I'm in that job, that it requires so much more physical than other jobs. For example, now in dermatology, that I can be more educating patients, I can be more in like an office job almost, that doesn't require so much of my physical abilities to carry on with the job. I don't need to stop. I can still be active and still keep going with it.
Absolutely. Peter, you've had a very long career as a dermatologist, a long and very distinguished career, and yet you haven't seen that many patients with GPP throughout that time, have you?
That's right. But in total, I think in my whole career of 35 years, I would say I have seen about 25 patients with GPP.
Right. I mean, GPP is, as we know, it's a rare condition. You yourself have said that, over 35 years, you've only experienced 25 cases. What I think is potentially helpful, I don't know if you agree, is the amount of information on social media at the moment. And if you've just been diagnosed, you may be very hungry for information. And as I understand it, there's a lot of blocking of pictures of skin conditions like GPP on social media. What do you feel about that? Because wouldn't that help with diagnosis and understanding of the disease if the visual pictures were there?
It is indeed very, very important to get information from the visual pictures. Of course, how does generalized pustular psoriasis look like? But also important that you get information on what sort of triggering factors are there which may aggravate the condition, and how can you cope with generalized pustular psoriasis.
Absolutely. Peter, what about the physical symptoms of this disease? And what's it like living with them on a daily basis? Do people sleep well if they've got itchy skin, they're tired, there's redness? Tell us a little bit more about these unpredictable physical symptoms.
What in my experience is when a flare starts, the patient feels this already before. In many situations, the patient feels fatigue, feels not exactly fine in the general way. And then pain starts, painful skin. And then you see some redness, and followed by some pustules. And that's also the time that often fever is there and other complaints. And then the fever starts, can be very sick, but then scaling dominates, a lot of scaling. And following the scaling, actually, it can be that the skin again looks totally normal. And then after a variable period of time, it can be maybe a few weeks, but sometimes a few months, in some patients a few years, again a relapse occurs. So during the flares there are these feelings, but in between the flares it can be that the skin is maybe not painful but more itchy, and that there is a superficial scaling and maybe some red scaling areas in between. And it is not exclusively the skin where you see changes, but is also the feeling of illness and of more general symptoms like malaise, like feeling not well. And this can differ. The degree of the general symptoms can differ between patients, but also in one patient. I have seen in many patients how different episodes are there.
Nerea, would you like to add to anything like that? In particular, your lived experience and the physical effect it has on you. I mean, when you're having a flare, do you sleep at night?
So Peter has described quite well how the cycle of the flare starts. And it's basically, I'll wake up one day and I'll see some pustules, and maybe the pain is not there yet, but within 2 or 3 days, those pustules become like a range, like in a circular way. And within a week or two, I'll start feeling the pain underneath the skin, kind of like pins and needles, kind of like a crawling sensation underneath. And I will know that, okay, it's a flare coming, even before the physical symptoms are completely visible. You might only see some redness, you might only see a few pustules, but the general feeling and that kind of pins and needles pain under the skin starting, then is when I know that a flare is coming. So normally it kind of starts in the flanks of my torso and kind of spans to my arms, spans to my abdomen, my back, then the legs. When it comes to the legs, in that kind of circular way, within a week, it can just feel like an explosion. So it comes all over my body. It might heal in the areas where it started first, but it will progress in other areas, like the neck normally is one of the last areas that appears, but it's one of the most painful areas where anything like even the t-shirts, even the softest t-shirt that I have, it will be painful when it affects the soles of my feet or the back of my hands, the palms. I can't grab almost anything because everything will feel like pins and needles under the skin. And obviously the pain is really a factor for my daily basis. It affects everything. And then the pain, the itchiness. Also, I feel like my skin is very tight. It doesn't matter how much cream I put on, how much moisturizer, and how much I try to keep my skin healthy. I feel like it's pulling apart almost. And I'll wake up in the middle of the night with that intense tightness of the skin with the itchiness at the same time, and if your scratch is painful, you might cause some wounds as well, like obviously no one thing, but in the middle of the night you might be scratching and then you wake up and you have some blood in your bed sheets. So it is affecting in such a large area that it does cause you a lot of distress mentally as well.
And can I ask you, what do you do? Do you close the front door and not go out? Do you avoid social events?
Well, there is times where you want you want just to crawl into bed and not want to deal with anything because you can't even deal with yourself. But obviously, as time goes on, you can't get the psoriasis, you can't get the GPP dictate what you do. So when I start the flare, I always try to start positive, knowing that I've lived that many times and that I have come across the other side and be back to be healthy and be back to have normal skin. So having that in mind, that it goes through a cycle and I will recover, helps me. And then I try to do different adjustments to my life, even the way I dress. I will try to cover up as much as possible, but not only for people not to see, which sometimes it does help not to show to everyone, because not everyone will understand what's going on, but also as a protection, because your skin protects you from the outside world. And when it's affected in such a way, everything is painful. So when you put a good layer of moisturizer and then you cover with cotton, for example, I find that is the softest and what it helps me the most. It kind of like helps me to carry on with life, to go out and do my shopping as well. I will feel when my skin is affected in that way is that I have a lot of cold. I have coldness. I'm shivering when the skin is shading and there's all this scaling. It does feel that you're missing a layer of your skin, so you're cold. So by putting appropriate clothes, I feel way more comfortable and I feel that I'm able to little by little do more and more things that help me not only with the physical state by doing as much exercise as I can in that moment, but also with my mental state, as like going out for a walk will help as well.
Have you changed your diet at all?
I try to be as healthy as I can. I try to have a balance in my life, and I feel like that might have helped me as well to keep healthy in other aspects, not only on my skin, and that kind of correlates with it. But I don't think cutting down food in general might be helpful. I think just to have a healthy lifestyle is what is helpful.
Peter, from a medical perspective, what advice do you give to patients, particularly those who are newly diagnosed? Do you recommend drinking less alcohol, stopping smoking? Does diet actually make any difference?
Well, it's very difficult actually to retrieve scientifically based information on changes of diet related to generalized pustular psoriasis. And with respect to lifestyles, what scientifically makes sense is to avoid triggering factors where possible. Psychological stress, it is very helpful to inspire patients or give patients advice in how to getting in their life a sort of a balance, not to avoid stress, but just to find a balance and to help actually also to make the recovering from stress maybe more easy. It is important to be aware as a patient that factors in life may influence the course of the disease. Not everything is scientifically proven, and it is a sort of a discovery. So there is not a certain scientifically based anti-GPP diet, but be open for what the course of the disease is and what helps and what does not help.
Yeah. We've heard the word balance a couple of times in this podcast, and I think balancing the physical part of it along with the mental is obviously critical. As Nerea, you've found out, you've lived with GPP since you were 5. For people who perhaps have been newly diagnosed, would you suggest any kind of mental approach to the disease when you are feeling very depressed and, as you said, you didn't want to go out of the house? Things like writing a journal, meditation, stuff like that to keep the balance so that you don't tip over into depression.
Yeah, so I think we should give ourselves a big load of kindness and to practice gratefulness. Journalism is good as well. I keep it normally a journal when I have a flare, also like to try to understand a little bit more my disease and how my skin works. I try to be as healthy as I can, not only when I have the flare, but after, and that helps me to kind of feel better with myself before, during, and after a flare. So try to eat healthy, practice sport, go out with friends. Obviously, when I have a flare, I will have to do adjustments. I will still go out with friends, but I won't drink because I know alcohol is a trigger. Even though I have a healthy diet in my normal life, when I have a flare, I will try don't get processed food because I know that that's, more fatty and might cause some more inflammation to my body. So I try to do some research to how could I be healthier even and having this disease, and how can I do different adjustments that does help me feel better within myself, and helps me as well to manage the depression and manage the anxiety that comes alongside having a GPP flare. But I feel like over the years, after every flare, learning a bit more about myself, and I'm learning a bit more of my coping mechanisms, I'm learning a bit more of how I feel, and giving myself some kindness and some understanding, and that also helps me to kind of cope on and keep going and keep as positive as I can. Also helps because I know this is a cycle. I know that it has passed other times, so why this time wouldn't pass, So it's just it's a learning process. Every time I have a flare, I learn a bit more of my skin and a bit more of myself, and it does help to be in the present, and it does help to reflect on it when it has passed.
Absolutely. And you're doing all of this, I presume, with a support network of friends and family who are on your side and give you the time and space to cope with this. Peter, do you agree that a strong support network is really critical for helping people feel less isolated? If you've got a strong sense of community lifting you up, you're less likely to fall into depression and other mental conditions.
Oh, absolutely. That is, we all, I think, are social people. In a way, we are part of a network. And with a chronic inflammatory skin disease, and in particular with generalized pustular psoriasis, the network can give also the power of recovery. When you have a flare, or when you are depressed, or when you have anxiety, also people in the network feel this with you. And it is very much of help. It is a little bit mixed how people deal with work situation. It could be that when people say at work too often that they cannot do certain things for reason of their skin disease, that it may be a little bit a problem that they may lose their job or something like that. But in general, that is not the best situation. The best situation is that based on the loyalty that the work has with good people, they also say, well, okay, we understand when you have problems, and then please, let's be flexible. And when you need really your time in the morning, or either to put on ointments or really to get going, there is no problem as long as we are informed that you come half an hour, 1 hour, or 2 hours later. There are difficult times and there are good times. And I think it is the most ideal situation in a work situation that there is a sort of an organic process of interaction with patients with GPP.
To wrap up this conversation, what types of resources do you think could help people more with GPP improve their mental and physical well-being? Peter?
Well, I think it is important to look at the resource sites that are from the National Psoriasis organizations, but also the International Federation of Psoriasis Associations, the IFPA. That IFPA is a very good resource to have a look at. What also is useful, of course, is to have a sort of intervention groups. Very helpful if you can contact other patients with generalized pustular psoriasis to share actual experiences.
Mm-hmm. And Nerea, what do you think about the apps that support mental and physical self-care? There are a lot of seemingly good ones out there. Do you access them yourself?
Well, I will have general ones just to keep a track on my activity, on my generalized wellness. I'll have yoga apps that I will use for mindfulness. I will have different, I think technology can help you, and if you're creative and you try to adjust what is out there to your specific needs at the moment, as is something, is an illness that keeps changing. So what it might work for you in some weeks might not work you for other weeks. I think it's important to keep creative and keep also in the present of what's limiting you in that moment, so you can adjust what's the best way to manage.
Nerea, Peter, thank you so much for taking part in this podcast. Thank you for sharing your journey and your experience. Thank you.
Thank you.
Thank you.
Thank you for joining us on Getting Clear on Psoriasis. We hope this episode helps people with GPP improve their overall quality of life and well-being. If you like what you've heard, be sure to rate our podcast, write a positive review, and spread the word by sharing with your family and friends. It'll help more people like you find us. If you have any questions, thoughts, or suggestions for us, you can send us an email at podcast@ghlf.org. This podcast was produced on behalf of Boehringer Ingelheim and distributed by the Global Healthy Living Foundation. Discover more about GPP at www.patient.boehringer-ingelheim.com/GPP.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.